Thank you, Dr. Leonard, and thank you everyone for being here today. It is my pleasure to introduce our Grand Rounds speaker in recognition of National Disability Employment Awareness Month, Dr. Alyssa Ware. Dr. Alyssa Ware holds a Bachelor of Arts in Psychology. She also has a master's and PhD in social work from the Catholic University of America. She is the executive director of Family Voices, which is a family-led organization that is committed to centering and amplifying the voices of families as leaders in transforming healthcare. Her work there and beyond centers on empowering families, particularly those navigating complex medical and special healthcare needs, to improve the systems that take care of them. Her work really is a testament to her deep commitment to advancing equity and accessibility within our healthcare system. And she has served in numerous titles, one being as a principal investigator on multiple grants, including a PCORI-funded initiative building capacity within the African American autism spectrum disorder community. She's had numerous academic contributions to the medical literature, furthering our understanding of equitable engagement in families in research, practice, and policy. And in addition to her scholarly and research work, she's a passionate advocate, and she lends her commitment to policy and leadership and community and family engagement. So please join me in giving her a warm welcome.
Well, that may have been the hardest thing I had, was listening to something about myself. So, but thank you so much for having me. I'm glad to be here to talk about something I'm super passionate about, which is the power of family engagement in changing systems. And so today we're going to focus on how do you get to a more inclusive and accessible healthcare system. And I fundamentally do not believe that you can do it without the voices of those that are experiencing that system, helping to define what's working, what's not, and moving forward. But it always is. People have a lot of passion for it, but how do we get there? How do we do it? What are those steps? And we're going to go through that today. Before I get started, I won't linger on this slide. You got to hear a little bit about me and my bio, but I will tell you that my number one job is that I am the mother of a amazing daughter that is autistic with many other co-occurring conditions. And that is what brought me to this work and what I lead with every day. I will tell you, at 23, she is her own advocate. She sits on a lot of advisory committees and is doing this work on her own, and keeps me honest and centered. And so this is her at 18 months old, when we had no idea, and she was just her funny, innocent, quirky self, that we were trying to figure out what were her needs, but a lot of complexities already at 18 months. As she turned 8, that was when we actually got her diagnosis. So we were on a diagnostic journey 2 to 8 years old, trying to figure out what were her needs, and really settled on it at 8 years old. And that has, again, what I realized at that point was I was entering a system that wasn't really built for me and wasn't really built for my daughter. And so how could my voice help to drive that system along in order to work better for families that look like mine, experience similar things that I'm experiencing, and therefore they could have better outcomes. And so today, I always like to say where she is. This is actually her college graduation from her bachelor's degree in music performance. But she is in her second year in social work school right now at Boston College, and thriving and living her version of independence. And that's a whole book to come around how do you navigate that and get to independence. But it is why I do this work, and I think it's important to ground my talk in that. So as you walk away today, my hope is that you walk away with some key principles and practices of the Family Voices family engagement model, to understand how meaningful partnerships with families can improve healthcare outcomes and systems, that you recognize where the barriers lie to inclusion and accessibility in healthcare settings, and examine how family engagement can address that. And then what are those strategies? Again, that how do we do this? How do we actually operationalize this with our busy days, our busy schedules? And so we'll share a bit about that. So I always like to start with the why. Why is this important? Why does it matter? What is the background here? And so I'm certainly, many of you probably know many of these statistics, but what we know is that not even 18% of children receive care in a well-functioning system of care. And I think that speaks to that we're talking about over 80% of children actually aren't receiving the care that they need in a well-functioning system. And so, we as a healthcare system and as healthcare advocates need to figure out how do we move forward and address that. We also know that for children and youth with special healthcare needs, that drops even lower, right? So we're at about 13.5% that also receive that care in a well-functioning system. And really, the lack of consistent, coordinated care can lead to, as you all know, those adverse outcomes, higher costs for everybody involved, from the families to the hospitals, et cetera, and increased use of emergency departments. So we often have built a system that was really centered on the industry, on providers, on what it is that they need, how do hospitals function better, how do they keep the bottom line clear. But we've seen that with all of the challenges that we're having, a real shift to centering everything that we do in all of our systems on child, family, and community-centered care. And we also know that patient experience has become an increasingly important focus. We know that hospitals get incentives for experience. We know that there are many things, that systems that are driving how do patients actually experience it. We see a shift to conversations around value-based care, but we still have work to do of how do we actually get there to improving those experiences. And so the research has shown that certainly family engagement improves the quality of care, parent and family satisfaction, and families' communication and relationships with healthcare providers. So when we have that engagement at any level, and I'm going to talk to you about some of those levels today, we know that that actually improves patient experience. We also know that lived experiences and insights can provide valuable guidance for reimagining the system. I was at dinner last night with a group, and I shared that I worked on a project, and the team was stuck, and it was a team of providers and health systems thinkers and researchers, and they had been grappling for a while. When we took it to the families, 8 pages of feedback later, they had answered all of the questions that they had for months. They didn't want something unreasonable. They didn't want something outlandish, which I hear a lot. It was really practical feedback that, like I said, really guided the work and excelled it forward by months. And then co-creation and co-design ensure that health services are tailored to the real needs and desires of patients, which is essential for building trust. And we know that trust is critical in order to actually have people want to access care and actually get the care that it is that they need. So with that in mind, Family Voices embarked on an environmental scan that was both funded by the Maternal and Child Health Bureau as well as the Lucille Packard Foundation for Children's Health on what is the framework? How do we manage this? How do we actually do it? We conducted about a year and a half of surveys and focus groups for families and young adults, the same for maternal and child health professionals, and listening sessions with maternal and child health professionals as well, and ultimately designed both a definition as well as a framework for actually how to move through and really work with families in order to engage in systems change. What we found is ultimately it's complicated. It is not, and before I get to the next slide, it's not as simple as I brought the families to the table and ta-da, we're done. That is the pitfall that I deal with over and over again, and it actually takes a lot of prep work and a lot of thought, and we're going to walk through all of those pieces. Before we start, I want to actually get to a definition, because when we talk about family engagement, people think about many, many different things. And so as we define it from Family Voices standpoint, it is an intentional partnership between, and that's a word that came up over and over again in all of our listening sessions and focus groups, is that there has to be a level of intentionality to what it is that we're doing. but it's between families, youth, and health-related service providers across the systems of care. Family engagement is grounded in, and again, these are all the pieces that kept coming up in themes as we were talking to people: mutual respect, shared decision-making, and the recognition of the unique expertise that families and youth bring through their lived experience. And so from that, we actually established a family engagement framework. And so, as I said, it actually is a really complex process that has three critical parts. And so I'm going to walk you through what those parts are. But the first part is really stepping back and saying, what's the context that we're actually operating in? So what level do I actually want to engage a family? So I'm going to assess that in that context. But then I also want to think about what is the environment I'm bringing them into. And that's actually the step that often gets missed is, what is the environment? Am I creating the container where family engagement can actually happen? The next piece is going to be our continuum of engagement. So what determines the flow of information? Is this a one directional? Is it two directional? What is the, and we're going to talk about that. None of those are bad. It's just, what is the purpose of the outcomes that you're trying to achieve? And how are you actually sharing power with families? And the third piece is, okay, I figured out my environment. I figured out how I want the information to flow and the power dynamics. Now, who do I need to have at the table? How do I actually need to share the information? And how do I actually recruit those individuals? And so that's really your planning for engagement activities. So first, as we start assessing the context and family engagement, I will tell you we actually started the Family Engagement and Systems Assessment Tool, which was funded by the Lucille Packard Foundation for Children's Health. We've been working on that for about 6 or 7 years. We had to step back and say, this is the piece that we're missing. We have to help people understand, am I even ready for family engagement? What is the setting in which I'm bringing families into? Because this was where we saw constant tripping up of people who actually wanted to engage families in some of this systems level work. And so we had to really say, you have to say, where am I actually trying to engage families? So when we think about the family level, we call it family. In a lot of the literature, it's called individual, but we want to really honor that a child sits in the context of a family. And so at that family level, right, you are having that one-on-one engagement as providers with youth and families to partner in managing the care of one child, right? That partnership is really important. We want to have shared plans of care. And so if that is the level, then that has its own implications. The advisory level is youth or families participating as advisors inside an organization. So for example, the hospital could have an advisory committee that you're using, and you're going to them for advice. And they serve as an advisory capacity, but you're not co-creating with an advisory committee. And I think that's really important to think about because it is at just a different level than where we start talking about getting into those subsequent two levels. For community level, the interaction is with actually organizations and groups that serve many children. So you may partner with a community-based organization in order to really drive forward the work that you want to do. And then we get to a systems level where youth and families who work with policymakers and systems change leaders work across the hospital at kind of governance and big project levels to develop policies and systems that serve children and youth. So it's really beyond their individual child. It's beyond actually that individual relationship. But what I will tell you is that the family that works on the systems level has achieved a lot of times the relationships at the family level, right? They have worked on their child. I call it going from the me to the we. So I had, when I started this, everything was for my daughter. I'm focused on that. I'm really centering everything I'm doing on how do I improve care for my daughter. As I've moved along and I'm operating at this systems level, I'm thinking about the we. How am I improving care for all families, again, who have children have similar diagnoses or similar circumstances. And so we see that trajectory also happen in the families that we engage. The other piece is are you creating the container and are you ready? So, like I said, this is one of the biggest challenges that we have seen. At this level, we know that many people are starting really at the baseline. They're unaware of family engagement. They're really, like, oh, is that a thing? I'm used to sitting in rooms where we all think it up as professionals and we drive the system forward. Many people start there. And then they start to dabble and can shift into questioning. And with questioning, we are really at a place where I recognize that family engagement exists, but really avoids a role in developing the strategy for family engagement. We can see some pushback on budget and time frame. We often hear things like, we don't have the money to do family engagement. We know it's important, but how much is it really going to change what it is that we do? And that's a normal part of the development process as you're moving, actually engaging families in the work that you do. We then see organizations, as we work with them at Family Voices, really begin to shift into this interested area. And a lot of people and organizations really rest there for a while. They have initiatives without a family engagement strategy. So again, they brought the families to the table. They've said, yes, they're here. They've said, okay, this is great. But there's no real strategy or commitment to like, this has to be here. The focus is on recruitment only and education and trainings. The engagement is often a one unit or department. It's not across an entire organization, and often has one or two family leaders that they always go to, they always tap into. And then we get to invest it, where we all agree that we have a team of family leaders, that the family leaders have autonomy, that the family engagement is measured and improved, vulnerability and transparency exist. And this is kind of the gold star, right? That's our North Star. We want to get there. But I want you to understand that if right now you sit in this room and you're at baseline, you can get to invest it, right? And so it is a developmental process of just really understanding all of the complexities that come with family engagement. And so as I walk through, right, we know that I won't belabor this, but it is ground zero at the baseline level. And so it may be your starting point, and I don't want you to leave this room discouraged by that, because often people don't understand the why. And why is this important? We know what to do. We've seen this happen over and over again, but it can really make a difference. And again, we can move through these different areas where we don't continue to make some of these same mistakes and challenges that can really impede the family engagement that we want. And so we want to be able to move through. So I'll click through these for time purposes. We do have an assessment that we can share out with you all, that is all about, let you kind of check off where you are as an organization to assess, am I ready for family engagement? And if not, what do I need to step back and do in order to ensure that I'm ready? So then we get to determining the flow of information and power sharing. This is actually the idea about power and how it shows up within family engagement is super critical to actually living it out. And so I'm bringing you back to the framework, but we want to really focus on that continuum of engagement. The continuum can be used to facilitate deeper and more meaningful collaboration with youth and families. So for each part, there are meaningful actions an organization, provider, or initiative can take. And what I will tell you is a real, true, in-depth family engagement process actually involves all 5 of these levels, all happening at the same time. So when we talk about inform, that's that one-way communication process. It is where a healthcare provider or a health entity shares information in one-way communication. So when we talk about that, sharing clinical updates or policy changes without requiring input, notifying patients and families of safety concerns in a clinical compliance or context, and announcements about a specific event or requests for applications without expectations of feedback. And remember, I said, this is also really critical at the informed level. The key is, how did you actually create this information? that goes out in that one direction. And so we're going to talk about some of these other levels that can actually let you co-create those materials that then go out to families that you're not going to get further impact and input. So the second piece is to consult. So a two-way information sharing in which youth and families have the opportunity to respond to information shared, but they really have limited power. They're going to come, and this is where those advisory groups can be really powerful. They're going to come, they're going to give you their information, but it's really at a higher level that some of those decisions are made. You're going to take into consideration their feedback. You're going to apply that to your thinking, but they really have a limited, power structure in which they operate. So as we think about that, examples can be a two-way feedback between families and clinicians on care plans, if we're talking about at the individual level. And anytime an individual or family presents a specific need or barrier is an opportunity for two-way information sharing. At the involved level, we're getting a bit deeper. We're sharing power more. We have, we actually see the youth and families as key informants in who offers feedback on their preferences, beliefs, recommendations. But again, they still don't hold really that decision-making power and often are not informed about how their participation influences the outcomes of an initiative. And so that can actually be a big challenge. While it is circular, we don't always see those feedback loops happen at the involved level. And so sometimes it can be a one-time engagement, such as a focus group or an interview. You really want to get their input and take to seek input without shared decision-making. Or a youth or family and caregiver is asked about their preference in a treatment plan, for example. So when we get to collaborate, this gets to where we start to really say, okay, we really want to share power. We really want to get into some decision making, but we're not quite at where we're on equal footing. And the thing I'll say about the collaborate level is it can look like and mimic the next level that I'm going to talk about. But power is really integral. And it is the piece where you have to be honest with families around this is above us, right? We're going to take this information. We value what you say. But the reality is somebody at the top of this hospital has to sign off on that. And so I don't really have a lot to say, and neither do you, in how we move forward and being really frank around that. And so sometimes the highest we can get is to get to collaborate because there isn't an opportunity to have true shared power between a family and a healthcare system. And so examples at the collaborate level can be youth or family caregivers are a part of the team conversation to think through addressing a complex health issue. We know bedside rounds, family-centered rounds and things like that can actually allow for the collaboration to happen. Youth or family caregivers work as a consultant or staff member involved in developing processes, policies, and practices. And youth and families serve as a QI team member. So that's deep involvement, it's heavy involvement, but it's also the reality that sometimes the power structures that exist may mean this is our ceiling for how much we can engage. Now, the North Star is to co-create. We got equal decision-making power. We're full partners in the work in all aspects in the initiative, from planning to implementation to evaluation to dissemination. We see families at the table really being equal partners in making those decisions and moving it forward. I work on an initiative that is funded by foundations, which I think actually lets some of this move forward and us get to co-create in a way that sometimes can be hard with government funding or things like that. And in that initiative, we have a governance body that the funders actually ceded the power for where the funds go, how they operate, and how the project is moving forward to this governance body. The governance body is 50% families. It is made up of 14 people, 7 of them are family leaders. And we have been really proud to engage in that work and move this and develop this model and show that it can be done. For 3 years, they have actually made the decision of where the money goes in various communities and how it's spent. And they ask some tough questions. Why are we investing in that? Why does it matter? in ways that I think the project would not have gone and the questions it would not have asked without that shared power. They have an equal vote, but it took the funders actually stepping back and saying, we're going to trust the community to actually guide this. And it's been a powerful experience. So I just want to share that it is possible to get there, but it takes a lot of seeding power in order to do that. And sometimes that can be hard in the relationships that we have. So again, co-creation does not happen in a vacuum. And that's really, really important to communicate with families. And so therefore, all parts of the continuum are included in effective family engagement, as I started with. So we figured out we have the container. We've readied our staff. They're ready to actually engage with families. We've taken the assessment. We've done all of those pieces. And so now what? What do we do? How do we actually plan for the engagement that we want? And so the big piece that I think is important to start with is what helps a family feel engaged? And I'll tell you, our family engagement and systems assessment tool is really interesting because when we actually use it, we ask families to complete it and we ask providers to complete it, and they always have different answers. They always have different answers. It is maybe 10% of the time that they are similar. Because what families actually need in order to feel like they are engaged can be different from how you're thinking about it. And so I want to highlight that there are really three key pieces. So in supporting families, you want to make sure that you're addressing the tangible, so that there are stipends, provisions for reimbursement, for childcare and transportation, and reimbursement for lost wages, all of those things. And what I will say about the tangible piece is that if you forego this step, you've decided who is actually already going to be at your table. When you have a family who can come and sit in your meeting for an hour, 2 hours with no payment, no nothing, that means that their socioeconomic status and the privilege that they walk through the world with lets them do that. And so you've decided already who you want at the table. And so this is a really critical piece. And I know we're in tight times where everybody's trying to figure out financial pieces, but it is how you actually ensure that people have what they need to be able to be meaningful participants at the table. We also want to make sure that we're thinking about the emotional. So when we talk to families, they say, I need respect, understanding, validation, and ongoing support to fulfill their roles, including times of transition and crisis. I'll tell you that all of the political things that are going on right now and the kind of chaos that families are feeling, every meeting I had since January with families, I've had to stop and acknowledge that this is tough for them. Trying to drive forward a meeting with a bunch of families who feel all worried and chaotic and that the world, all they want is you to stop and acknowledge that this is hard. And I'm glad that you took the time to show up, right? So that can be really critical. And that's some of the TA that we do at Family Voices to say, how do you actually, again, create this piece so that they have the support they need? Sometimes some organizations partner with us for us to be that support for them. We provide a contact, we mentor them. They meet with our team in order to say, how do you feel comfortable and ready in this environment? We would love to see that on a team. But sometimes the team isn't ready, and that's being honest about. We don't have the bandwidth to offer them that support, but we recognize that it's critical. And then the third piece is environment. So training, shared power, and full inclusion in activities. Families want to know what the rules that we're playing by. Families want to know, what are you expecting of me? One of the biggest challenges that we often see is families don't have a role description. What are they supposed to do? What are you expecting from me when I show up? How am I supposed to be thinking about things? And that can be really important in order for them to feel like they are showing up, making informed decisions, and able to properly share power. So now we're at the domains of engagement, and this is our framework for family engagement that's rooted in evidence that we said that we worked with a lot of families, a lot of cognitive testing to really figure out what are the 4 domains that actually exist that we need to be attentive to as we sit down and plan for who we're going to have at the table. And so we want to make sure that we are focused on commitment, transparency, representation, and impact. And so when we talk about commitment, what we really mean is that an organization always engages families they serve in decision-making groups, that there is somebody on your team that is a champion for family engagement, that says this project is not going to move forward unless we have families at the table. And you have an opportunity to be that person on your team, but every team needs one. And what I will tell you is without a family engagement champion on that team, it will fizzle out. It is a person that has to be there to say, I'm going to make sure that before we make a decision, how are we actually involving families? And so we work really hard to actually help organizations identify who that champion is and where does that lie. And then what does that champion do? Because there's going to be inevitable pushback. We want to move things fast. We want to get things done. And sometimes engaging families slows that process down. And so who's going to hold everybody's feet to the fire around that? The other pieces about commitment are that you have a policy. We have some great tools around how to develop a family engagement policy so that way everybody understands, what does this mean to our organization? We compensate families and recognize the value of their expertise and time. Everyone else at that table is getting paid. The family shouldn't be there and show up and think that they're not also going to be compensated for what they're bringing to the table as well. And then ensure equity, as many families cannot take time away from work. And as I said, if you don't, you've decided who you want at the table already. So considerations for compensation. This is the number one thing. We can't do it. We don't know how to do it. We can't figure it out. And so it is, it goes back to that we are committed to it. It is not something to add on later. I actually tell organizations that I work with that I want you to start with family engagement as your first line item, back into everything else. But what we see is that everybody backs into the family engagement, and that's how we get to the conversation that there's no money. And so it is challenging the way we do budgets, the way we handle business, the way that we operate in order to ensure that we have commitment to actually ensuring families are compensated for their time. Take into consideration other expenses families may incur. So I will tell you at Family Voices, for example, we have a policy around compensation that we don't do reimbursement. We want to give families enough money that they can make the decisions for their life. I don't want you to have to come to me and explain to me why you needed childcare and why you had to park in that $40 an hour parking garage and all of those pieces. We're going to set a rate that allows you to do what you need to do. And that can be anywhere from, and it may shock some of you, $75 to $125 an hour. I had a provider tell me, well, that's what I make. I can't pay them that. Oh, we said the quiet part out loud. And they said it to our funders, actually. And I was really proud of the funders saying, and so why do they deserve less? They have an expertise at that table that nobody else has too, just like you. And so it gets into, again, some of our belief systems around what it is that how we operate. And so it is mental models that we have to shift. And so I think around this, it's really important for you to step back and say, where do I stand on this? And how can I help to shift how we're thinking about it? When we talk about transparency, this is huge. And I will tell you, for communities of color, we actually, in the PCORI study that I did, developing the research agenda for African American families, how they define transparency is actually much, much more involved than what our initial definition was and what I actually have here. They want transparency from the beginning. I want to know at the beginning what you're going to do with my information at the end, before I ever say yes. So this actually is the make or break domain we have found, especially for diverse communities and communities of color, because trust actually lets us be comfortable with a lack of transparency. And so when trust doesn't exist, this becomes really, really critical. And so You want to ensure that you are describing the opportunity, you're giving that role description, you move families beyond the checkbox, and you're providing those mentors. Who is that family going to contact to say, I'm sitting at these tables with all these people with medical degrees, and I feel out of my depths. I have no idea. Why do they even want to hear from me? I can say this because I've heard it 1,000 times from families that have come to sit in front of me. And having a mentor to walk them through, like I said, you have a perspective that nobody else in that room does. And being able to stand in that and know that they have guidance and support to move that forward can be really powerful. Helping families and staff prepare for meetings, ensuring that they have all of the material. And I will say, because I'm at Stanford, an academic institution, we like acronyms and jargon. We do. I get caught in it. I'm in this world, but families don't. Giving a family an acronym list is actually not helpful. Can you imagine you're talking and you're still talking and you're still talking, and they're like, what was that word again? They have missed half of the stuff that we were going to do. So really thinking about plain language. I see my friend Lee Sanders back there, my plain language champion. Really ensuring that materials are accessible for families is critical to family engagement and a big part of that transparency. We want to be consistent and build trust over time. We want to schedule those meetings when families are available. They are not available sometimes at 1 o'clock in the afternoon. That works for your clinical schedule. It may have to be at 7 p.m. It may have to be at 12 when the kids are, especially in the summertime, they're down for a nap. There are all kinds of considerations, but we need to make sure that we're setting times that work for families and clear understanding of the role and responsibilities. And I'm just going to keep saying that because I see so many times we brought the family in and we just want to hear what they have to say. And families are like, what do they want me to do again? So that role description is really difficult. And on another initiative, the communities that we were working with 5 different communities. That was the biggest pushback. And so they wouldn't do it. We gave them the samples. We helped them write them. They wouldn't give them out. A year and a half into the initiative, the family, they're like, we're just not getting, like we're having an issue. We can't actually move this forward. And I said, do they know what they're supposed to give you? Well, I mean, maybe that's what's missing. So we're going to go back to that role description that we talked about a year ago, and let's go ahead and roll that out. Let's have a meeting. And that cleared up so many things. And so I just can't say enough how important that is to the transparency process. Representation is huge. As I said, when you don't compensate, you decide who's there. So is the community that you have actually representative of who it is that you're trying to impact? Who is experiencing the most disparities? And I'm going to talk about some of that in a moment, but this domain is really critical for making sure that you have the voices in the room that look like the problem. If the problem rests in 80% Hispanic families, do not have one Hispanic family at the table and 10 families from other cultures. It needs to look like the problem. And so really using data to drive your representation is super important to the conversation. And so you want to, again, also provide that mentoring. You want to make sure that there's skill building opportunities for both families and staff, that there are workshops about parent professional partnerships and things like that, so that that representation can be there and they have the supports that they need to move forward. We talked about that a bit, so I'll move on to impact. Those feedback loops are really critical. Families want to know that you're not just showing up and taking from me and I never knew what exactly happened. And so when we talk about impact, we are talking about how and where the organization used the family's input and ideas to improve existing policies, practices, or to create new ones. I hear from families all the time, I'll move to the individual level. Well, they had me do that assessment, but I have no idea what the outcome was. I don't even know why I'm continuing to take that screening. This can happen. This need for impact is regardless of the level of engagement that you have with families. And it certainly is a big deal when you're bringing families in the systems change. And so we want to make sure that we listen, So families know what works and what doesn't work about systems of care. So we listen to their lived experience. We work together to identify areas for improvement, and we work together to identify solutions. And we identify what has changed. So staff and families identify what the organization is doing differently because they were there. We document families' contributions. On some of the initiatives, I think what's fascinating is those are not reporting requirements that are in most grants. They don't want to know the process. They don't. I call it the mess in the middle. They don't really care how it happened. But it's a really important story to tell. And so I would encourage you, if you're doing that and you're doing robust work, start to write journal articles, even if it's not in your reporting, about the process you use to get there, because we need more information out there. And families want to share how we actually got there and how they actually impacted change. If needed, work together to create an action plan to improve family engagement and systems level initiatives. And again, the tools that we have help you plan, assess, and improve the family engagement you have. Excuse me. So when we talk about where do we go wrong, we can't get this wrong, right? It never happens. There are three things that we see that take place. So first is tokenism. As you see the quote, we have one. Again, there was a maternal and child panel, and maternal mortality was on the docket. It mostly affects Black women. There were 8 white family leaders and 1 Black family leader. They felt like we have the voice at the table. Yep, 1. And the problem is, exponentially more impactful, and each person is going to have a different experience. So there's lack of equitable representation. There's undersampling from communities with the greatest risk or worst outcomes. And so we have to be thoughtful about that, because that leads to people feeling tokenized. I can tell you, as a Black family leader, I have been the only person of color in a room many, many, many times over. My goal is for that never to happen again, and to bring other people in that are from diverse cultures, because that is important for us to get to the goals that we want. But it is a common challenge that we often see happen, and partly because we need to take the time to build the relationships with communities so that they trust to come in and be a part of the process. Paternalism is the second piece, and the quote I'll say there is, "We know how to help you. We're going to tell you already, like, this is how you can contribute. We already know. We have you at the table. We're checking a box." So there's an assumption that the public health entity has the answers. We just have the family at the table because it's required for our grant. Not understanding that communities have their own knowledge and solutions, and you won't solve a problem about them without them. And that's really, really critical. And exploitation. We don't need to pay family partners, and believing families should just be happy to be in the room, and undervaluing lived experience and expertise. And so these are big, big mistakes. Again, we can label all 3 of them because we see them happen a lot. And we want to make sure that we actually are calling it out and saying, this is what it is. If you have the same families, I actually took a call from entity, and they said, well, we've had the same families we've been working with for the past 12 years. And when we started, their kids were young and using the program, and now their children are adults. So they no longer use your system that you're trying to change, which is the whole purpose of the family engagement, is to engage those. And I said, so what do you think about those families mentoring new families? And they, like, the light bulb came on. I never thought about that. And so you're not setting them aside. You're graduating them to a new role where they get to bring additional voices in. And that's how you can begin to avoid some tokenism and exploitation and things like that we can get into. So what are the barriers? Last night we had a dinner, and I said families are not hard to reach. That's a whole other talk. It's a whole other hour. We're not going to get into that, but they are not hard to reach. They don't necessarily want to be found. And I think shifting how we think about that, because that then means that in order to actually access them, I have to be intentional. And that's back to that word we talked about earlier, build relationship and build trust so that then we can be in the type of relationship that will actually develop into systems change. We have policies that don't support engagement, so there are many challenges around funding and how different entities actually view and value family engagement. And so we do trainings on building your case for family engagement to your C-suite, to your higher ups in your organization, so that you can really be able to tell the story and use the data in order to be able to make the case for why an institution should actually continue to fund family engagement going forward. Not preparing the environment for increased diversity. We often can see, I have been on initiatives where, we want families that are from low income communities with, minorities, blah, blah, blah. So those families show up and they're not polished, right? They're not, all the right words and the big academic things, and they're not like me with a PhD, and I all of those pieces, and that actually then can shut the conversation down because we haven't actually prepared the environment for everybody's not showing up with the same background and information, and that's okay. But we have to walk into it understanding that we have to be open to get to a level of conversation that is appropriate to engage with various types of community. That goes into seeking the star parent or unicorn. So I get emails all the time. We want your help recruiting. Here's the role description. Great, you got a role description. And so we need a family that has published 5 papers and comes from, but also engaged in the child welfare system. And we need to make sure that they have a child that's 3 to 5 years old, and they have that person, I mean, that person might exist, but the chances I'm going to pluck them out and be able to recruit them for you is slim to none. And so we need to be careful about that and understand that family leadership is a developmental process that we can be intentional about continuing to help families actually be able to engage at the table. Feeling helpless to solve the problems families identify. This is number one. They're going to ask for something we can't give. 95% of the time, families want really practical, concrete things. And families also are okay with hearing, we hear you, we know that this is a challenge, and we want to do better, but this is what we can focus on right now. They want honesty, they want transparency, and so that's important. And the final piece is power dynamics. We can't shy away from it. We have to own where the power lies, and we have to communicate that back to families. The piece I want to say about co-creation that I think I talked a little bit about before is that what it is and what it isn't. I hear this word thrown around a lot. We want to co-create with families. It is inclusion of families early in the process. It is being willing and flexible to change the process based on family input, and it is sharing power. But what it isn't is completing tasks and asking for feedback afterwards. It's not being inflexible about processes and intended outcomes or power concentration right at the top. That's not co-creation. And it's okay to say that, but then we have to say that. We can't call it co-creation, and then the reality is we're not sharing power. We're not actually having families from the beginning at the table. We're not doing all of these things. And so really understanding, again, going back to that continuum of engagement, where you actually fall becomes important so that you're communicating that out effectively. So some key tools that I will leave you with that you can find on Family Voice's website is tools to plan, assess, and improve family engagement in systems. And so those tools are, we have a user guide, we have a score sheet, we have a family engagement and systems toolkit, but it really lets you, again, plan the, if you're starting from the beginning, where do I go? How do I actually manage this? We have a checklist that helps you walk through that. If you already are doing family engagement, how am I doing? And really assessing that from where you sit right now, and then how do I actually improve it? I want to get better in these domains. Maybe my representation isn't great, and I actually want to make sure that I improve that and bring more diverse families to the table, because that's what the problem looks like. And so those are my references. And so with that, I think I turn it back to you, Peace, for questions.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.